any news about breast cancer that's good news, I want to share immediately. There is news of a breast cancer vaccine. It's a trial, and it's giving hope to many. Some preschoolers will soon be eligible for the COVID vaccine as well. And to talk about all of this, we have Dr. Kohli here. So thank you for joining us, Doc. All right, so a clinical trial for breast cancer vaccine has started. Does this mean we are closer to a cure? We're still in Breast Cancer Awareness Month. We have people on this panel with loved ones dealing with breast cancer. Now talk to us.
Yes, one step closer, guys.
Wow.
It's so exciting. So, you know, if you think about cancer, one of the hardest things we have in terms of dealing with it is diagnosing it early. So if our immune system, which is our soldiers, start to recognize the cancer early and start to attack it when it's microscopic, that's called cancer immunology, where you take your immune system, activate it against the cancer. So that's the concept here. Why do we only use our immune system to fight infections? Why not use it to fight the cancer? So you give this vaccine to women that have recovered from this, what's called triple negative breast cancer, teach their immune system how to recognize this cancer so that if it comes back, the immune system attacks
So
it.
it's like they're turned into the Avengers or X-Men, like you're X-Menning your immunity against cancer.
Oh, I like it. Which one can I be?
No one liked
Which one was the one with the white stripe?
Yep.
Storm?
Storm.
Storm. That's who I want to be.
That's the one.
Yeah.
Al, don't. Just read your thing. Al.
All right, we're going to talk about COVID after that. You clearly don't watch the X-Men or the
I do.
Avengers.
I'm just saying what she's saying is they're arming themselves against it. That's smart thinking. That's preventative. That's good technology. That's X-Men.
No, it's not. You can't just throw it. Okay. Okay. I love her. Okay, let's talk about COVID. Currently, the CDC is recommending that everybody 12 and older should be vaccinated. As a parent of a 7-year-old, this hits near and dear to me. This Tuesday, the FDA is reviewing a vaccine for approval in children as young as 5. What should parents like myself be concerned about? What should we know?
So let me lay out the data for you, Al. Then I want to hear what your take is as a parent. We have really good data that kids 5 through 11 who get this mount an immune response similar to adults, have side effects less severe than adults. And then when you look clinically, they have greater than 90% protection against symptomatic infection. All very good news.
That's great.
But the sample size, the number of kids we've studied is 4,500. So the tiny, 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 tiny signals that come up when you start giving it to millions of kids, we don't know about yet. And the specific ones I'm thinking about are myocarditis and pericarditis, inflammation of the heart that we saw in some adolescents. Now, we think based on Israel, it'll probably be okay, but I really hope that this gets approved today. What would your take be as a parent?
I would, even if it was considered experimental, I would vaccinate my youngest. I mean, you can't keep sending them to school and putting them on planes and not expect something bad to happen. And I just look at kids almost the way I look at cars. Like they have a new model just rolled off the assembly line. My kid is healthy. His body's going to respond vigorously to things as opposed to my 44-year-old body. So God forbid anything does happen, I'd like his chances to make it through better than mine, actually.
You're stacking the deck for him. That is exactly what I think. The risk of something bad is extremely low, whereas the benefit of protecting him against COVID, I mean, he can go see Santa Claus this Christmas.
Yeah, he can get on a plane. It's a big deal. And, we have older relatives, and you want people to see people.
Right.
Very, very true. Well, good information. Thank you very much, Doctor. DBL Nation, of course, if you have a question you want answered by Dr. Kohli, write us on social media.
Or a question about the X-Men.
I think I know. You can also email info@dailyblastlive.com. Go Storm. Thanks again, Doc.